Good evening, everybody. So let me introduce myself. Myself, Dr. Shankar. I am being the head of biochemistry and immunology for DDRC Agilus Diagnostics, Kerala. So today, I am here to just to present a topic on hospital lab management. So first of all, I would like to inform you about the beginning of a new era, actually our era of excellence in diagnostic with a brand new identity. Before you know us as DDRC SRL. Now it's our brand new identity as DDRC Agilus Diagnostics. Even in its rebranding, we really uphold our creating values towards all the stakeholders in the view of our patients, in the view of our public and society, our partners, our planet, even to our people and employees too. So, moving forward, what is the importance of hospital lab management? In that, I really want to focus with a story. So, always stories makes history. I hope I'll just tell a case. In such a way, a 19-year-old female came to a clinic, a hospital. She doesn't have any history of subclinical hypothyroidism. I mean, of course, she has a history of subclinical hypothyroidism and not in treatment for a very long time. And the nutshell is, her TSH count was less than 0.01. It was low. And if the TSH is less than 0.01, that means that patient is having hyperthyroidism. Naturally, every doctor will think like that. Because by the lab values only the diagnosis is made, thereby the treatment is taken. And naturally, the doctor doesn't feel anything clinically related to that. So we have been informed. So we took the primary sample from the clinic. We done the test, we retested the, we have just done the test again in the same technology and the same kit, because as we have almost every technology. And we also perform free T4. Okay. But see, we have always a study protocol on confusing results. So what we did is, on the same sample, using the same kit, same technology, we did the run and the value was less. On the same sample, another kit, another technology. On the same sample, another kit, another technology. However, usually the TSH value is usually correlated with the free T4, and as a part of protocol, we did it. So what is this problem? Is every machine reliable? Is every technology reliable? Of course, God has made anyone perfect. So naturally, the technology is made by man, so technology has flaws. So it is a responsibility of the professional lab team to know the boon and bane of every technology and every chemistry. So anyway, we had to collect a repeat sample. In that way, we have collected a repeat sample, same pattern. I don't want to go for the case study presentation and everything. At least I should tell, as I have told this much, I should tell what it is. It is none other than a mutation, structural mutation of TSH is referred as R55G mutation. So this is just a story of trust. The clinician trusted us, the patient family trusted us, the first lab of that clinic, the hospital trusted us. So it's all the trust comes from the teamwork, the updated data, the dedicated and dedication and the commitment, and evidence-based research work. So, I will tell, lab like us are always one step ahead, and this emphasizes the importance of hospital lab management. When it comes to hospital lab management, we have to focus on certain things. The point of things which we always focus on is, number one is the running cost of a lab. Then we'll come to the employee cost. We'll come to the infrastructure investments. Then we come to the margin of the profit. Then, of course, the professional team to meet the challenges. Of course, as a lab, challenges can come. To meet that, a professional team is needed. And the kit, the consumable wastage, and the most importantly, the timely result, the TAT. So the challenges is always there. So in that terms, we will face a challenge, we'll provide the service for that, and in a good way, good profit. So our Agilus Diagnostics, at a glance, we have more than 400 labs with our presence in various states and union territories, and a lot of enable accredited labs also with the numbers still counting from 45, and 3 special centers of excellence, especially on histopathology, transplant pathology, and molecular diagnostics. And going towards our same, as well as diagnostics, in another point of view, because of our large-scale annual test running capability, trusted by a millions of people, as we are providing lot of robust test menu. I mean, lot of tests in the test menu, which is done by our more than 70,000 plus employees, which we have been training them in a specific way. So the overview of services hits a lot of parts. As I know, I am here only for regarding the hospital lab management. And we are managing over 120 hospital labs, both in private and public sector. That's my point. We are managing it in private and public sector. So there is our journey, and in that journey, we have some points to, we have some kind of, we got some feathers in our crown on the run. Okay. And the most important thing in any hospital lab management is the logistics. Logistics. So we having even a modified, I mean, not in the modified, the kind of modern form of logistics, even the drone logistics we are managing. That's a fact. Of course, we have been also being equipped with the accreditations and alertance certifications, starting from NABL, the CAP, and of course from NAB, the hospital which was supporting us, we also helped them for the NABH and the RNTCB stuff and DSIR recognition and everything. Going forward, there is a kind of, as I told, these all are the picture about us. Then, regarding the DDRC Agile setup, we are right now managing in Kerala 18 HLM labs. And focusing towards it, we have different specialities. So, coming to the model of HLM, there is a part that has to be done by the DDRC Agiles, as well as there is a part that has to be done by the hospital management also. When we focus on the HLM part, the part that has to be done by the lab or the DDRC Agiles diagnostics is they will do all the operation expenses, as well as the capital expenditure for the laboratory and the pathology service. Why I tell pathology services? Because as we all know, in the laboratory medicine part, like biochemistry, immunology, everything, at one point of time, it was pathology. It all derived from pathology. That is the fact. So that's why we told just pathology services. And it is being enabled by a sophisticated, updated IT system support too. As I told you about the logistics earlier, including the drone stuff, it is also taken care by the lab itself. Then quality control stuff and the accreditations. But there are some responsibilities for the hospital, which is in business with the HLM room. Because there we need a rent-free space, as well as a common utilities like a water supply, security services, FOC, housekeeping staff, likewise, and uninterrupted power supply. And we need some space for branding, as well as to act as an interface between lab and the clinicians. As well, at the end of the day, it's all about laboratory clinician communication when it comes to a laboratory service. Because it is one of the most important jargon of nowadays laboratory services, lab clinician communication. Coming to the HLM model, telling about the space and sections. The space and sections are decided based on the feasibility and requirement of the analysis for the particular health facility. And the test menu, it is based on the volume and the hospital requirement. Telling about the prices, it comes to a negotiation part and everything. It depends upon social grades. And agreement, minimum lock-in period of agreement is 5 years. Then the focus really changes to the other model, the revenue sharing model. It is basically based on annual or monthly business op projections. And some point of considerations are, of course, there like a price escalations, logistics scheduled, non-performance and minimum commitment date, cut-off data, something like that. And the lab type, whether it should be a 24-hour lab or a kind of 8-hour, 10-hour, 12-hour lab. Okay. So this goes with certain special packages considerations also. So these are the facts which we consider under the HLM model for any responsible lab. Of course, we have been provided with the best of the automation, as we cannot involve all the automation in this, just some photos. So most importantly, as I told you, it's all about facing the challenges, providing the services, and making good profit. We are here only because you people have supported us for this very, very long time. So I am also using this occasion to thank you for supporting us. And as you're supporting us, we will not let you down. We will work for your glory too. So, Dr. Hari Shankar, as well as diagnostics, thank you.